Okay, finishing up on the Streptococci. We went over Group A Streptococci, Group A being the Lancefield grouping. In this one, we're going to move on to Group B Streptococci. Streptococcus. Okay, Group B Streptococcus, for example, Streptococci agalactiae, which you can see here, differ from Group A by being resistant to the antibiotic bacitracin. And the capsule of Group B does not confer antibody resistance. However, Group B strep also produces proteases and hemolysins. So that basically means we'd expect it to be cleaving proteins, and we'd expect it to show up on a hemolysis plates as either beta hemolysis or alpha hemolysis. Group B strep tends to colonize the lower gastrointestinal tract, so newborns are vulnerable, but maternal antibodies help protect them against Group B strep infection may be onset early at less than a week or as late as 3 months, so vigilance is necessary. Diseases associated with Group B strep in newborns can have a mortality rate of over 50%, but this has been reduced to 5% with rapid diagnosis. So a strep infection occurs in approximately 3 in every 1,000 newborns. So it is a problem, and we do need to be vigilant of it. But fortunately, through modern medicine methods, we've been able to massively decrease the infant mortality rate from strep infections. Diseases caused by streptococci include neonatal bacteremia, meningitis, and pneumonia. Group B, so if you don't know, pneumonia would be if the streptococci infect the tissues of the lungs, causing inflammation, fluid buildup. Meningitis would be if the streptococci are causing inflammation in the meninges, which are kind of these protective layers in between your brain and your skull. If they swell up, it puts pressure on the brain and it causes meningitis. And neonatal bacteremia is a disease where streptococci bacteria are infecting the eyes of mainly infants. But we have a method to treat that now, which we're going to go on to in a second. So Group B strep is treated similarly to Group A. So remember, Group A can be treated with penicillin or erythromycin or cephalexin. Group B can also be treated with penicillin or streptomycin. What did we do to there? I'll just highlight these quickly so it's easier to see. So Group B can be treated with penicillin or streptomycin. Some Group B strep are highly resistant to penicillin. So if we got one of the penicillin resistant strains, we'd prescribe streptomycin. Immunization also helps to defend newborns. Newborns to mothers already colonized with Group B strep, so if the mother has a Group B strep infection, they're generally given this thing called prophylaxis, which is a preventative treatment for infection in the form of an erythromycin ointment onto the newborn's eyes. So you can see on the right here, there is this baby suffering from ophthalmia neonatorum, which is this kind of neonatal bacteremia. So you have strep infection of the tissues of the eyes, causing this kind of crusty pus appearance. If this baby we would expect this baby, its mother would have had a group B strep infection, which has caused this newborn to have ophthalmia neonatorum. We are able to prevent this now by, if we have a mother who has a group B strep infection, we smear this erythromycin ointment onto the newborn's eyes as soon as they're born. And this kind of antibiotic is going to kill any of the group B strep that have landed on the baby's eyes as it was being born through the birth canal. So that's how the baby would have got these group B strep on them. When they were being born, they would have picked it up through the birth canal. So just putting this erythromycin ointment onto their eyes through prophylaxis, they're not going to get this nasty ophthalmia neonatorum, and they're going to be healthier. So that's kind of an overview of group B strep. There are other kinds of beta hemolytic streptococci. Group C strep, for example, Strep equismilis. It causes pharyngitis, which we talked about before. It's just a sore throat infection. You have groups F and T streptococci, like Strep anguineus, which can cause a purulent abscess. Moving on to other kinds of streptococci, so we're no longer talking about the Lancefield groups, we're going to talk about different kinds of strep. Viridians streptococci lack Lancefield group specific carbohydrates and typically cause opportunistic infections, usually from plaque on the teeth, which is a biofilm, and bleeding gums, so you're breaking the skin barrier like we talked about for Staphylococcus epidermidis and aureus. The bleeding gums is going to result in a breaking of this barrier, so the Viridian streptococci can make it into the bloodstream, and we're going to have an opportunistic infection resulting in meningitis, so swelling of the meninges, putting pressure on the brain like we talked about before, or endocarditis, where you're getting inflammation of the endocardium in the heart, and build-up of Viridian streptococci plaque behind the valves of the heart, making it hard for them to open, and that's obviously a problem. Just highlight these quickly. Moving on, we have Streptococcus pneumoniae, which is a kind of gram-positive diplococci, so this kind of structure rather than the longer chains. It's an alpha hemolytic and produces dimpled colonies, so alpha hemolysis, it still has these hemolytic enzymes, but it's not breaking it down as much. They are sensitive to the antibiotic optocin, I don't know, it's kind of hard to pronounce. It's a normal flora of the pharynx, and it causes opportunistic infections in the sinuses, lungs, and the middle ear when they produce phosphorylcholine, which stimulates cell receptors in these regions to engulf and hide the bacteria. So I won't go too much into that. You know what pneumonia is. I have kind of been talking a bit fast, maybe a bit jumbled, so I would always just advise kind of reading the slides. The slides have all the information that you need to know. My talking doesn't really add much to it, it's just for people that are a bit too lazy to read. So the body produces immunoglobulin A antibodies to bind to the pneumoniae to mucous membranes, where it can be swept away by ciliated epithelium. The bacteria counter this with protease enzymes that break down the immunoglobulin A and production of pneumolysin, which binds to cholesterol of the ciliated epithelial cells, lysing these cells that can also produce meningitis and endocarditis. Pneumonia is treated with penicillin.